And action! Hey everyone, it's Dr. Rick. Happy holidays. Today is it's going to be Christmas Eve tonight, but I thought I'd shoot this for lack of doing anything else on my vacation. So, if this is the first time you're finding me though, don't forget to hit the subscribe button if you like the content I give, and the alert button to find out when I do new videos. So Tony had a question about low testosterone, and low testosterone is unfortunately really common with a lot of my guys. It used to be common in my 50 to 60 year olds. Now I'm seeing it in the 40-year-olds and a couple in the 30s. So I think there's a lot to be said of the 24 hours of online access, social media, TV. I remember I used to watch TV until like 11 or 12, and then it would go snow. The MTV would go off, and then you see snow on the tube. Now you can, from any parts of the world, you can have very stimulating conversation. Or Netflix is available where you can just binge watch, and the directors are very good. They'll make you want to watch the next one. And if you think, just watch another 20 minutes, and then you realize 3 hours later, oops, it's 4 o'clock in the morning. So we'll just talk about some common stuff, but I'll mention about calming and getting away from media later. So there's a couple things. If you have low T, number one, first you have to diagnose it. And there's blood testing, but blood testing can be very iffy depending on your sleep the night before, if you've been fasting, if you just drank alcohol. So blood testing, if you can't afford saliva testing, is fine, but if you're going to get blood testing with me especially, I want the blood test first in the morning. I want them after a decent night's sleep for you. And you can't, and also if you can stop all supplements about 3 days before, that'd probably be the best way. I not only get testosterone testing, I get adrenal testing, cortisol and DHEA. I think those are usually pretty good, in addition to sex hormone binding globulin, to figure out a ballpark. Now this can be also with women too. There are different parameters for the testosterone, free testosterone, and total in women and men, but we'll just speak about it for men for now. So blood, if you can be very good with when you collect it. Now the problem is, I'll also send patients at 6:30 or 7 o'clock in the morning, and sometimes they get there thinking, just roll out of bed, I'll be relaxed, and then there's a line. And then they have a problem reading my stack of orders, and it sounds like, I bet you the lab people are probably saying, why are we ordering this? I'm sure they're grumbling to my patients. And that already initiates a stress reaction. And when you have stress or a stress reaction, then you're going to have a low T. And temporarily, you can't have that fluctuate. That's why it's really important to have it in the morning. So if you can kind of this would be ideal. I know it's an extra step. If you can get to the lab beforehand, have them maybe the day or a couple of days before, do whatever they have to do with register the blood tests, then just walk right in. I think Quest will actually have a reservation for you, I think. I'm not sure. But around here, it's ACL, Quest, LabCorp, and then the different hospitals. Hospitals charge a lot of money, but if you're HMO, you have to go wherever you can go. Now, saliva testing is more accurate, I think, because all you got to do is you get these little Labrix is a nice place. Genoa Labs is nice. They give you little tubes. You just wake up, you put your saliva in. Well, there's more steps to it than that, but you put your saliva in a little tube and you bottle it up and you send it away. Really cool. That's definitely accurate for cortisol testing. Because theoretically, has somebody approaches you with a needle and has somebody wraps your arm with a very tight tourniquet, your cortisol level jumps up and your testosterone can sometimes flub down. So there's a lot of things. That's why I'm saying it's sometimes inaccurate when you get blood testing, but if that's all you can afford, that's fine. But either way, you want to have testing first to document how low it is. Sometimes we'll also test other things, inflammatory markers. If your insurance really is cool, I can sometimes get insulin-like growth hormone or growth factor, but those are usually, or an MRI of the brain to see how the pituitary is doing, but you'll probably not get that paid for. In fact, we should probably just jump straight to, if you have low testosterone, you might want to try taking testosterone. And testosterone pills? No. Testosterone creams? Yeah, maybe. Testosterone injection, probably the best. There's now pellets too, but really pricey. But if you have low T, then you should consider getting testosterone in while you fix all the other reasons for the low T. And there's a lot of reasons. Again, this is not just the decline of human civilization, that low testosterone has gone from 60 years of age to like 30 years of age. I think there's a lot of other things to be said about modernization of our work schedules, our shift work, poor sleep, a lot of pollutants in the environment. So I think several different things are accumulating to give us a low testosterone. But that's not good, obviously, because it leads to other things: obesity, fatigue, irritability, poor sexual performance, and then that's going to be a hit to the species. So eventually that's going to be a problem. So I don't have a problem with using testosterone if there is documented low T and if we fixed everything else that we can take care of. Sometimes what I'll say is you probably should try it for 3 to 6 months at a time. And if I'm going to use testosterone, if your insurance will pay for it, then great. Sometimes we'll use the creams. That seems to be covered by most insurance companies if you have good insurance and if you've made deductible. And remember, this is going to be, it'll be at least 3 to 6 months to start, but it could be several years. So you have to kind of plan your spending. If you can't afford that, or if you want to go higher end, compounding pharmacy. There's a guy named Matt who owns Wholesome Health Pharmacy in Hoffman Estates. Great prices for his testosterone that he compounds. And he uses natural products, so it's a little bit more natural than buying the pre-packaged testosterone from the pharmacy, some of your regular pharmacy. He's a compounding pharmacy. That means he's a pharmacist who did extra training to compound. That's the old-fashioned way where you grind things up, you mix things together, and you create. And you can personalize the testosterone amount and the delivery system with compounding pharmacy. So I love the way Matt does it, and he offers a very good price, so always an option. If you don't live in Illinois, you can actually call his place and he gives a discount. I believe he gives a discount to pay or make it even out as far as shipping. So tell him I sent you and see what he can do. So that would be the first step, is to consider testosterone, whether it's creams or injection. Obviously, if you're getting an injection, you have to get it with a doctor. If you're going to get the pellets, you have to have that performed by usually a urologist. But that's a little more permanent and very expensive. There's also, but again, if you're low, then you might want to take care of it temporarily while you fix other things. Sometimes I'll have a handful of guys taking HGH. That is the kind of the precursor. There's a hierarchy of hormonal cascades that start from the pituitary and go down to the testicles. And there's hormones that release every step of the way. Without getting into the details of biochemistry, HGH will help you produce testosterone, but that is a more aggressive form of hormone therapy, and it's harder to get, and there's more ramifications because it's a higher level. It doesn't only affect testosterone, it affects other hormones in the body. So you have to be careful. I think that testosterone will be easier to accomplish. So I have a handful of guys taking HGH. They're doing well. And there's a Dr. Jeffrey Life who uses a lot of hormones in a lot of older people. He seems to be taking care of his clients well, but I think it's kind of cheating. So there's a difference between testosterone supplementation if you have low T and the symptoms of low T, and then there's also the bodybuilding, the CrossFitters, the competitive martial artists or athletes who use testosterone in the wrong way. So you have to be careful about what you do. I actually hear about some guys using insulin injections after a workout to produce bigger muscle. And there's different hacks that you can find on the internet. There's different places on the internet you can get testosterone, HGH. I would be very careful about what you get, where you get it from, how you use it. The one good thing about the FDA is that they make drug companies test and present studies, although the studies are probably biased. They do have to produce a plethora, probably $1 million+ just for one study to show that there's need for their medicines. So there's also, again, when you use hormones, you have to be careful of the blowback. Progesterone cream helps to keep testosterone as it is, because the body has this way of when the body makes testosterone, it doesn't just keep testosterone in the bloodstream. The liver will sense the amount of high testosterone that just got injected or rubbed on, and the liver will try to break that down into inert products and then poop it out. So sometimes what happens is the liver will see the high testosterone and it'll make estrogen to get rid of it. So estrogen, that's why some bodybuilders get what's called bitch tits. because they have the breast tissue that it's gynecomastia that develops from too much testosterone. So sometimes using progesterone or different herbal Christium is another thing to decrease the conversion from testosterone to estrogen would be helpful. I think a lot of guys would naturally use progesterone at night anyway. I think it helps as a cream. I think it helps to calm the brain down. A lot of women who aren't necessarily having a lot of hormone flashing at night will use progesterone at night, cream-wise. I think it's very good. So those are the prescription ways to take care of low T. Again, you have to get blood tests before and blood tests after to determine if it's working. Hopefully you'll feel a difference, but it's still nice to document how good. And you probably should give yourself a break and watch the liver, because all this hormone injected has to be digested and broken down and detoxified by the liver. Sometimes the liver, if it's already dealing with high fructose corn syrup or cholesterol or triglycerides, will really get backed up, and then you'll have problems. So Al Alzado, a big football player in the NFL in the 80s, developed liver cancer, supposedly from overuse of anabolic steroids. And there's also Viagra, Cialis, and Levitra. Those aren't really they're not really for testosterone boosting, but they do help with erections. And this takes a little bit of time to dial up. You can't just start out of the gates if you have a low T or a borderline low T or just symptoms of a low T, but the blood tests look okay. You can't just take the highest dose of testosterone. You have to start low and work your way up, low and slow, to find and dial in your amount. So while you're waiting, because it might take 3 to 6 to 9 months, Viagra, Cialis, and Levitra are really nice to use for consummating the sexual performance at night. It just takes less stress out of the relationship. This is sometimes not covered by insurance. I've heard some pharmacies charging $30 a pill. So I found a place in North Carolina called MediSuites. Pretty decent place. I've had a couple patients they take their prescriptions and then they fax it over to these guys, and I think it's like $1 a pill for generic, which is pretty decent. So another pharmacy that's, for some reason, I think North Carolina probably was a place where they developed a patent and they lost the patent, so that's why it's now just generic. So now we've talked about all that stuff, let's talk about natural remedies for low testosterone symptoms. There are a couple things that I suggest my guys take, especially if you're in your 60s. Soft palmetto is awesome. Soft palmetto also helps to decrease the size of the prostate for guys. It will work, again, I'm going to keep this very simple without going through the biomechanics or the physiology. It will work to keep testosterone produced by the testicles and by the prostate, or the stimulants by the prostate, but soft palmetto is nice. I3C usually comes from dark leafy greens, especially the collards. Very nice. Also works as a great cancer-causing or cancer-fighting agent. I just did a video on eating for cancer. Check it out. I'll put a link down below. Tribulus terrestris is also a nice herbal to use on a regular basis, but these things, included with that is horny goatweed. These things do take some time because, again, you can't just take the highest dose and then you'll be tempted to save money by getting something that has all 4 ingredients plus a couple other things. And I think that when a company says that they have a proprietary blend including all this stuff, I don't know if I trust that. I'd rather spend the extra money going to consumer labs, seeing if they evaluated these things, including zinc. You don't really have to worry about the quality of zinc. You can just get zinc over the counter. But I think zinc also helps the prostate. I think these 3 taken separately, these 4 taken separately for about 3 to 6 months should provide an improvement. But then you're going to be on that until you take care of the biggest reason for low T. I don't think it's just a coincidence, as I mentioned when we first started this off, that the low testosterone phenomenon is translating over to our 30 to 40-year-olds. I think it's because we're overstressed, underslept, and overdrank. So the musts, that whether you decide natural or prescription, the musts are you have to get good sleep. There's supposed to be 8 hours, with some people falling above and below that curve, but it's supposed to be 8 hours. It's supposed to be refreshing sleep. It's supposed to be same sleep hours every day, weekends included. You can probably sleep in on the weekends or wake up a little earlier, but sleep is a must. Because if you don't have sleep, then the body is in constant, even though you can get through the day, body's in constant fight or flight. When you're in fight or flight, even if it's an incremental dose of fight or flight, you don't have testosterone that's being made. You have cortisol and adrenaline. So it's either cortisol, adrenaline, or testosterone. You can't have both. So sleep is important. And there's a couple things that you can do to push sleep. I just had a lady call me yesterday while we were having a birthday celebration. And she said she just came back from India. And since her time in India, she has had difficulty with anxiety coming back to the U.S. And we went through a couple different things, and she even brought up herself. She thinks it was the time in India that has brought out the anxiety. And it's not necessarily just the time, it's the sleep that was off from there to here. It's on the other side of the world. And she probably has to fix the sleep, but I gave her something else to calm down in the meantime. So sleep is very important. I like DHEA and ashwagandha. DHEA is something that stimulates, it's like a precursor for testosterone. Use that in the morning. And ashwagandha can be used in the morning, but it's more of an adrenal supporter. It's called an adaptogen. I use it at night because, I would tell my patients to use it at night because it does help initiate a little bit of sleep or a sleepier time. In addition to, I'll put another link down below, fixing your night rituals. So it's very important to always, you can't just take this stuff and then keep on doing bad things, because this won't work. I had a guy came in from another state to see me, and he was on testosterone, high doses, and his blood levels were great, but he was totally falling apart. So I think that his doctor just gave him a testosterone injections. He's injecting himself. I don't know how he did that, but he did inject it himself, and he was still feeling the effects of low testosterone. Poor muscle mass with his exercise, weight gain, erectile dysfunction, and I think it was because he did that without doing these things. So it's very important that you do the musts here. So sleep is very important. Also, alcohol. Alcohol, there's a couple things here. Alcohol, narcotic pills, both of those things lower T. They also lower performance. They might make you feel good for the short time, but you're going to lose your T levels or your sexual performance prowess. So those are important to avoid. And xenoestrogens, or estrogens that are things in the environment that you get from canned foods, plastics, pesticides, foam, that will pretend that they're estrogens. When you have estrogen stimulation, you're going to naturally lower your testosterone. So you got to avoid excessive amounts of alcohol, narcotics, and poisons. I put BPA here. Bisphenol A, that's just one form of a thing that you might find in canned foods or plastics. I believe I mentioned that in my Eat for Cancer video, so check it out and look for where I put it. In addition, you have to learn to calm. Calming practice is one thing that most Americans don't do, and whenever I have a patient that needs to develop a calming practice, I say the best coach for calming practice is a psychologist, and suddenly there's a halt that's put on because nobody wants to see a psychologist for some reason. And I see a therapist. I think it's very important. It's not just for couch time, it's for having an expert design a calming practice for you. Just like if you're going to start with CrossFit competitions or marathon pacing or marathon competitions, you want to have a coach that's been there before and worked with thousands of athletes to find the best way to dial you in. Even if you are a yoga practitioner or a meditator, TCM, Tai Chi, I still think it's important to have a coach to bounce your practice off of a coach to see if there's anything that you can do to fine tune it. Visualization is also important, and sometimes guided imagery can be produced by a psychologist or a licensed counselor. So calm is important, at least twice a day. Again, you're either in stress or you're in love. So you can lower the stress response and you can increase the love response. Avis Selhub did a great book on the love response. I'll put a link down below too. Check out her book. You also have to be intense. So calm and intense, not at the same time, but calm when you can get it into regular practice, and intense meaning exercise. I think high intensity interval training, resistance training is very important. Having muscle, sometimes when you're exercising and you're tuned in, it gives you a temporary feeling of high testosterone just because muscle, for some reason, and a fast heart rate and a muscle pump or being swole makes guys guys and women feel good. And there's something that's euphoric about that. And again, if you do it on a regular basis, turning it on when important and turning it off when important, it would help this whole process. Hormonal cascades will flow so much better if you got the basic building blocks of proper eating, proper sleep, love, and happiness. And we get that when we're in our teens and 20s. We kind of lose it once we start families and getting into more job performances and job duties, mortgage, retirement, all that other stuff. So stress of losing a loved one, the holidays, all these things are important to turn off the reaction that that stuff has to us so that we can perform until we're 100 with hopefully no disease and no suffering. Finally, there are a couple of herbs that I suggest most Americans take, especially if you're north of Georgia. Vitamin D3, omega-3 fish oil. I think they're very important. D3 usually is lacking, and because of the melanoma suggestions from our dermatology colleagues, most people try to avoid the sun or they put sunblock on. So even if you're out in the sun south of Georgia and tan, it doesn't guarantee that your vitamin D levels are 50 to 70. So I think just taking vitamin D is good enough. You can take vitamin D even in Chicago throughout the summer. There's no problems with it. There's only a small percentage of people who go higher than the 70 range, and sometimes I think there's 2 studies that show plaquing of the coronary arteries is high or higher when you have too high of a vitamin D level. But again, I only see that in a handful of patients of mine. And omega-3, that doesn't have to be fish oil, but omega-3 oils are important. And then comes the ideas about cholesterol, saturated fats. I just think that if you have to be, this goes against the Dean Ornish's work with heart disease patients, and I'll have another video on eating for heart disease, but I think that we take in, even vegetarians take in too much omega-6 and not enough omega-3. And the way it works is that omega-6 and omega-3, when they're in the diet, they go through the same pathway, and if you have more omega-6, it gets through the bottle. There's a bottleneck in the metabolism of omegas. It gets through faster, and there's no omega-3s, and omega-6 is considered pro-inflammatory. Omega-3 is the anti-inflammatory, so you have to jack up your omega-3s to get that in there faster for the benefits of antioxidants. And that would help with developing and producing your own hormone levels. So it also helps with sleep, also helps with inflammation, all that's a positive reinforcement for this low T. So hopefully, Tony, this gives you a little bit of an idea about what to do with low testosterone. You're not alone. I would be very careful about getting shortcuts. There is no shortcut, and there is danger with doing shortcuts. Even though you'll hear about it on some of these YouTube videos, I'd be very cautious. I think there's ways to bring things up without having danger, and they can hopefully be covered by insurance. So good question. If any of you have any ideas or treatments that you've tried, put them down below. Otherwise, we'll see you next time in the Minute Clinic.